Welcome, well done for logging in. This is just a quick PowerPoint that I've created just to cover a few bits related to the VARTEC process, so that we all have quite a nice understanding of almost kind of the framework we can use to assess our fitness tests for this first assignment. So what I'm going to do, I'm just going to sort of rattle through the slides. I would encourage you to pause the presentation at any point and replay anything that you wish to go over again. I'll try and give a few ideas about also how you can, maybe give you a few ideas about some of the specific tests that we're covering as part of your first assignment. So let's crack ahead and see how we get on. So as we've been through before, it's Unit 7. This is your first of 9 units, and this is the first learning outcome, which is just to know a range of laboratory-based and field-based fitness tests. In the overall qualification, you can see this one just covers that P1 and M1, so the most you can get as a merit out of this assignment. It's describe one test for each component of physical fitness, including advantages and disadvantages, and you're explaining the advantages and disadvantages of the test for each component you choose. So the descriptions you're creating are only going to be able to get you a pass, so don't spend ages and ages and ages doing the descriptions. Make sure they're nice and concise, but make sure your explanation of the advantages and disadvantages is the part where you give most of your time to, basically. Later in the unit we move on to health screening and then on to performance testing. So the performance test, you'll probably use some of the tests that you're describing here. So make sure your work's very good, and you may be able to reuse a certain amount of it. And then this is just the grading criteria, and also that little section in the bottom. This is what we call the range, the unit content. So what we need to do is make sure that you're referencing or sort of mentioning most of the main titles in here. So for example, it says you cover fitness tests, and then it says flexibility, e.g. sit and reach. So that means you have to cover flexibility, and an example of the test is the sit and reach, as opposed to something like the individual joint assessment that we also did. Under strength, it says e.g. 1 rep max or grip dynamometer. So grip dynamometer is a really easy one to do. Whereas aerobic endurance, you've got a few more examples you could use. So it's got multi-stage fitness test, step test, maximal treadmill protocol, etc. So that's why I was sort of driving you towards the YMCA 3-minute test, because it's quite an easy one. So it'll be useful once you've completed your assignment to look back at this and just see how you've covered each of those components. Oh, that seems to come up blank. Let's move on. So the purpose of this is really to explain the meaning of the VARTEC concept. So that's not really directly referenced in the unit content, but it's quite a useful tool for us to kind of use as a framework to explain the advantages and disadvantages of all our tests. It's a kind of nice way to sort of, a sort of structure an analysis of the test that you're using. I want you to understand how to assess the validity of tests, and I also want you to gain ideas for your completion of your assignment 1. So I've got here some pre-reading. I think there's a really nice article if you Google PT Direct and then just add validity and reliability to that. Before we start, it's useful for you to write down your definition of validity in fitness testing, define accuracy from a fitness testing perspective, and define reliability. So make sure that before we start you've got those really clear and that you've read the PT Direct article. I've linked it on the bottom there, and hopefully it works, but I'll send out the presentation to everyone as well. So it's a fairly lengthy article, but it's useful to work through before you start. You can also use it as a reference during your work. equally the chapter of the book that I gave you is also a good start. So start with validity. So validity really refers to the extent to which the test that you're using actually tests the component of fitness that you're wanting to assess. So if we consider validity, let's imagine you've spent ages learning to play the guitar. You've gone to lessons each week, and then you've set yourself up for an exam at the end of the year. And at the end of the year, they give you a flute exam. So quite simply, that's a very obvious example of an invalid test. In the same way that if you spent a whole year training for a marathon, you did lots of aerobic work, lots of running, and you turned up on the test day and it was a sprint test, that's obviously an invalid test. So that's a really obvious way of sort of looking at validity. Does it test what you really want to test? You could be a little bit more subtle in a way and say, well, actually, if I learnt to play the guitar, like this chap on the left, you know, he looks like he's got a sort of acoustic guitar, then would it be fair if it was an exam in a sort of electric kind of rock-based guitar, or a sort of Spanish guitar, or a bass guitar? So you could have one sort of style of music that's, you know, very different to another style of music, even though the instrument's the same. So if you looked at something like, let's say, aerobic fitness, the step test is a valid test of aerobic fitness. A maximal treadmill test is a very valid test of aerobic fitness. The bleep test is a quite valid test of aerobic fitness. So to a certain extent, the test almost sort of needs to be valid for that client group as well. So the first thing we'll look at is you know, to what extent the test compares to these sort of gold standards we take. So in something like for an aerobic test, for example, the gold standard is that you measure maximal oxygen uptake, the most oxygen you can take in and use during a minute during maximal exercise. So you do that in a lab, you use very expensive equipment, you use gas analysis, which is expensive. So we use predictive tests that hopefully get close to the figures that we get from those tests. So rather than putting everyone through a sort of you know, a gas analysis VO2 max test, you might use, say, something like a Queen's College step test, which predicts your maximal oxygen uptake from how your heart rate has responded to a sort of set stepping exercise. So that's quite a valid measure. We can also sort of consider whether a test is valid for a particular client group. So again, going back to my guitar analogy, if you'd spent the whole year training for a marathon, you know, very aerobic work, and then you turned up and you had to do a cycling test, that equally wouldn't be right, would it? You know, you could have a very valid bike test that's very good at predicting maximal oxygen uptake, but actually for that client group who's been training running, it doesn't work either. So validity is really determined by a number of factors. Most of all, does it give you a good figure compared to that gold standard? And number two, is it valid for the client group you're working with? So we looked at the YMCA step test, and I just noted here it's a valid measure of aerobic fitness used in a number of settings. The ACSM guidelines for exercise testing and prescription references the test as a simple to perform screening tool that can be used with a wide range of client groups. So what you get, I've got on that top right, you don't really get an estimation of VO2 max per se. You just get given a sort of a grouping that you're in, so you're excellent, good, above average, average, etc. So in that sense, it's, you know, it's all right, isn't it? It's not a gold standard measure of maximal oxygen uptake, but it's a good indicator of aerobic fitness for a wide client group. So in terms of its validity, it's all right for general populations. You know, if I wanted to find out if someone was generally fit, I could probably use that test. If I wanted to measure very sort of subtle improvements in training over a period of time, that test probably isn't the one, is it? It's not valid for use of for high performance athletes. You might also think actually some people, you know, if you've got very elderly clients, it's hard work stepping at that height for 3 minutes. So there's some groups you might choose not to use that test with, but it's, you know, it's a fairly valid measure of aerobic fitness on a very generalized level. So here I've got 3 tests, 2 with pictures. So just have a think about for a minute how valid you feel these are at measuring sit and reach for flexibility, hand grip strength test for strength, and the 1 minute press up for muscular endurance. So just pause the video, write down, I'd say 3 points for each about how valid you feel they are, with a nice explanation that you can give me. Okay, so hopefully you managed to pause. If you're looking at the sit and reach and you're considering the validity, well, you can say, you know, that chap there is obviously quite a flexible fella. He's got very flexible hamstrings and a very flexible low back. He looks like he's done well. Does that tell us much about where, you know, if he was maybe injured, where that was affecting? Would it tell us where to direct a stretching program? Would it tell us much if he was any good at, you know, if he was flexible enough for something that requires rotation, such as tennis or golf? Probably not. So it's a good sort of screening tool, but it's quite good for sort of spotting if people have got kind of sciatic type symptoms when they bend forward, which might suggest some sort of disc problem. And you'd probably find in a general population, the people who do well on that test are generally more flexible, but it might not be quite specific enough for use within groups of athletes. The hand grip strength test, again, generally, you know, you'll find if you lined up 10,000 people, probably the people that score best on the grip strength are probably generally the strongest. But it would be annoying, wouldn't it, if you'd spent 6 months training your sort of squat and your bench press, and your coach measured your progress by giving you a hand grip test. It wouldn't seem valid, would it? It wouldn't seem to relate to the training you've done. And lastly, the 1 minute press up test, which is again a good general indicator of muscular endurance. So if you had, say, you know, 1,000 army recruits and you wanted to get an idea who might have the best muscular endurance, then that's probably not a bad one to do, is it? You know, you're just screening people out. There you go. Right, you've done brilliantly at this. You might have potential, but there's not that many sports which use that sort of pressing motion continuously for 1 minute. So for someone who's a cyclist and you want to assess muscular endurance, no use. You know, someone who's a rower, not much use. A footballer is not much use. So again, it's a good sort of, it's a valid test if you want just a generalized picture of someone's generalized muscular endurance, but maybe it doesn't really sort of stack up for use within many sports. So I've got here, hand grip just measures grip. In a population, generally those that score well will generally be generally stronger. And I just asked the question, is it sensitive enough to record training progress or make selection decisions? The sit and reach just measures hamstrings and low back. In a population, you might find that people who score well are more flexible overall, generally. But the question I ask, is it sensitive enough to guide a stretching program or determine is someone enough, for example, tennis or golf, something that requires rotation or that sort of 3D movement? So if we're considering the VARTEC, the A is for accuracy. An accurate test is one where you can record the results clearly and consistently, and being able to record the results accurately is key to having confidence in your test. So the two that I think are really sort of maybe challenged by this accuracy is the YMCA 3-minute step test, where we measure heart rate either at the wrist or the neck, and you've got a partner doing it for you. So inherently, there's almost like a, you know, you will lose beats when you're counting someone else's heartbeat. You know, if someone's heartbeat is you know, even 120 a minute, which is pretty normal, that's twice a second that you've got to keep track of, and you've got to keep recording for a minute. So it's quite hard work. So naturally there will be errors because you're doing a cumulative heart rate as well. You're not sort of taking a sort of a 15-second snapshot and multiplying it by 4. You're measuring a cumulative heartbeat for 1 minute. Same with a 30-meter sprint. You've got to start that stopwatch bang on the time they start and stop it bang on the time they finish. So the sensitivity, you're doing a test that should last about 4 seconds. So you want to be as accurate as you possibly can. You may lose 0.1 of a second just by pushing it too late. You may lose 0.2 of a second by sort of stopping it too late as well. So you've kind of lost already 0.3 of a second, which is a huge variation in timings when you're dealing with just such a small amount. It wouldn't matter if that was the amount you were doing let's say an 800-meter race, something that's much longer. But over 30 meters, that sort of 0.3 of a second is critical. So we're sort of concerned by the accuracy of tests. We want to make sure that our equipment is good. We try and calibrate equipment, so things like scales, things like calipers, we can calibrate to make sure they're as accurate as possible. But always in our testing process, there's elements where tests can be inaccurate. The concept of reliability, a reliable test is a test that you can rely on to measure something consistently. So for example, the one where the collection of results you can kind of guarantee, but you have that confidence that you're getting a sort of very clear result that's very repeatable. So a reliable test would be one where if I took the test one day, or I administered a test one day and gave it to a colleague a few days later to perform exactly the same test, we'd be likely to get very similar tests because the protocol's very strong, very clear, the testing methods are very easy to gather, and we don't require too much. Well, the skill level is something that we're appropriate for. So something like a bleep test, for example, it's a relatively reliable test, isn't it? But people can cheat. You can miss people sort of not quite making the line in time with the bleeps. So if I'm administering the test on my own, then I sort of lack that reliability to a certain extent. In something like a body fat calipers, it's a good test. It's reliable if the operator is very skilled. So I would probably say you need to get a good sort of 50 to 100 under your belt before you're really confident with that test. So I could do the test skillfully on someone. My colleague could do it unskillfully, and so the test has lost its reliability straight away because that sort of operator skill that's required. So I think with the 6 tests that you're describing, think about whether you would be confident in having your own fitness assessed by one operator one day and then having your progress reviewed by someone completely different 6 weeks later. Can you be confident that that test is going to be exactly the same test 6 weeks later? So think about the sit and reach, pretty easy and it's quite reliable. 3-minute step test, tough. 1 rep max, it's difficult sometimes. Grip strength, very easy. So you can see, if you think about how repeatable those tests are and how confident you are in that data collection, that gives you some ideas about whether tests are reliable. Time, obviously, is just how long it takes for the test to do. So look at something like a 3-minute step test. It's 4 minutes in all. 3 minutes of stepping, 1 minute of data collection. So really, really simple, which is great. A minute either side for faffing around. So each test can be done in about 6 minutes. That needs someone looking after the stopwatch usually, and someone taking the heart rate. So a couple of people usually administer the test for one person. Now, if you think you've got to do that for a team, then you can start to see it becomes a bit of a pain. People sort of hanging around all the time to wait to be tested. So you can see if you're considering advantages and disadvantages of tests, that's quite a difficult one to do in large groups. You know, the advantages, it's great. It works nicely in a sort of it helps build rapport if you're a tester. But maybe a disadvantage is you've got lots of people waiting around if you're trying to get through a large amount of people. So it's not sort of not easy. So it should be fairly straightforward to comment upon the timings of each test. So consider the operator requirements as well as test length. So you might want to compare the bleep test versus a 3-minute step test. A bleep test might take 10-15 minutes to complete if you've got some fit people in it, but you can get 10, 15, even 20 people done in one hit. So it's just done. A real big advantage of that test is you get nice groups done. If you've got a few helpers, you can make it relatively reliable. You can sort of make sure people are hitting their lines on time, and so it's got some real advantages, I think, for a lot of client groups. Equipment, you need to comment on each of these. Don't go too wild. Consider how easy it is to set up. So that should say consider the ease and setup. Ease of set up. Should just say and the specialist nature of tests. These can include terrain and surface to standardise the protocol. So you might look at something like a 3-minute step test and think that can be done anywhere, but it should really be done in a very sort of standardised environment. So an ideal would be almost a gym floor with a very standardised, firm, sort of 12-inch bench. A bleep test really needs to be a very consistent surface, i.e. preferably indoors. Even sort of things like traction of the floor make a difference. You could have a floor that's very slidey, so people certainly later on are kind of disadvantaged as it becomes difficult to accelerate and decelerate. You could look at something like a 3G pitch, which actually is, they're quite sort of heavy to run on sometimes. So an indoor sort of sprung surface is probably the ideal. But I think the key thing is that if you do it on one surface, you have to retest on that same surface if you're going to get any real confidence in those results, if you're using it to monitor progress. You could consider if there's any sort of maintenance or calibration need for your equipment. So something like what do we call it? The bod pod, for example, needs to be calibrated each time you use it. It takes a sort of 5 minutes, but it's a thing. It's a faff, isn't it? Consider things that wear and tear. So something like the hand grip dynamometer, they're about 150 quid. It seems an awful lot, but I've seen ones that are sort of 15 years old. The same with Harpenden calipers. They're a couple of £100, but they last forever if you look after them. So what might feel quite an expensive piece of equipment actually can be quite cheap. And lastly, just considering cost. So again, consider the sort of requirement to have someone present who's skilled operating the test, as well as just equipment costs. So something like a 3-minute step test, the operator doesn't need to be hugely skilled, but you do need someone there. And again, consider if equipment is single use or reusable, and then just what I was saying about the cost before. So if you're justifying an advantage of Harpenden skinfold calipers, they are they can be bought very cheaply. You can get 10 quid versions, but I don't think they're particularly accurate, and if they're not accurate, then that brings into question the reliability. Something like a bod pod is incredibly accurate. It's quite reliable, very reliable, but it costs about £50,000, and it needs to be operated by a skilled person. Usually they're sort of people who are exercise scientists, and they also need to be stored. It's a expensive and quite cumbersome piece of equipment. So each of the tests it's a few good sources of information out there. Brian Mack is quite a good Google source. There's also a site called Top End Sport, which is very good. And I've given you a chapter on from a Stafford Brown book. The Stafford Brown book is still available on Amazon. Your course is the Btec Sport with the sort of sideline performance and excellence. There's a book by a lady called Jennifer Stafford Brown who teaches over at West Herts, and it's a really good resource for your course. So if you can still get hold of those, it will be the last year. Well, I don't think it's published anymore because your course is the last year it's running. But it'd be good to get hold of one. They're only sort of £14 or £15. They'll be second hand by now. But that covers a lot of good information for your tests, and I've copied a few pages of it for you. So for Friday, what I want you to prepare is these two questions. So I want you to prepare a full answer as if you were answering an assignment for me. Each of these you can actually build into your assignment anyway, so it might be a good way of practicing. So question number 1 is, to what extent do you believe the 30-metre sprint test is valid, accurate and reliable test of speed? Or is a valid, accurate and reliable test of speed? So you have to justify your thoughts and explain how you would ensure you have confidence in the results you measure, and if you're working with a professional football team. So imagine you're critiquing the test in the first instance, and then explaining how you would ensure that you have confidence in your results if you were working with a professional football team. And question 2 is, I want you to explain the drawbacks of only having access to the skin fold calipers as a means of measuring body fat percentage in a commercial gym environment. This is something I used to have to do a lot, and I used to hate it. So I want you to consider your thoughts around that. So prepare those 2 questions. Should be a maximum of a page. I would say a minimum of half a page. You can handwrite or you can type. It's your call. But I want you to bring your work for the session, and I'll see you soon. Okay, thank you very much.